Hello and welcome back to Synapse. This is Ritika and today we'll talk about breast cancer. Why should we know about breast cancer? Well, it is the second leading cause of cancer among women. So, what increases the risk of developing breast cancer? First, we have the estrogen exposure. A female is exposed to estrogen much more than a male. Women with earlier menarche and later menopause definitely have a much longer reproductive period and are exposed to estrogen for a longer period. Exogenous estrogen, such as hormone replacement therapies, also increases the risk of breast cancer. Postmenopausal women, especially obese women, have much greater risk, and that is mainly because the fat which is present in them gets converted into estrogen like substances, increasing the risk of breast cancer. Next, we have the exposure to radiation. Exposure to ionizing radiation before the age of around 30, when the breast is still developing, increases the risk to a great extent. Family history plays a very important role. Pregnancy and lactation reduces the risk of breast cancer, especially the first pregnancy within the age of 20 decreases the risk to a great extent. And diet, women with higher lipid and alcohol in their diet have much greater risk of developing breast cancer. Talking about the pathogenesis, we have the four main genes whose mutation is commonly causing the breast cancer. BRCA1 gene mutation is much more associated with breast cancer in females than in males. It is also very commonly associated with ovarian cancer, and that is why when we find a female patient who has family history of BRCA1 gene mutation, there is prophylactic mastectomy and oophorectomy done. BRCA2 gene mutation is much more associated with breast cancer in males than in that of females. And it is also very commonly associated with prostate cancer. P53 gene mutation is the most common type of mutation which is seen in sporadic cases of breast cancer. When there is inheritance of one mutated allele and another normal allele, there is a high possibility that this allele also undergoes mutation, and this will lead to breast cancer or any other consequences. This is called as Lee from many syndrome. The SHEC2 gene mutation is very commonly associated with radiation exposure, and it is also associated with kidney, colon, or thyroid cancer development. Carcinoma of breast can be divided into carcinoma in situ and infiltrative carcinoma. So, carcinoma in situ is where the basement membrane involvement is not seen. That is, the basement membrane is intact. While in infiltrative carcinoma, we see that the basement membrane is affected or it is infiltrated. Carcinoma in situ can be further divided into ductal and lobular carcinoma in situ. Ductal carcinoma in situ. As already mentioned, there is no basement membrane involvement, and thus the myoepithelial cells are preserved. It is commonly associated with necrosis, which leads to calcification, and this can be very quickly picked on a mammogram. DCIS can progress into an infiltrative carcinoma, and this progression has a rate of 1% per year. The DCIS could be comedo or the non-comedo type. In comedo type, we see high-grade tumor cells and there is central necrosis. And it is associated with linear or branching pattern of calcification. While in non-comedo type, there is no high-grade tumor cells seen, there is no central necrosis seen, and we see cribriform or papillary or micropapillary pattern of calcification. Paget's disease of the nipple is a special type of DCIS. So what we see here is that the tumor cells, let's say this is a cross-section of breast tissue and this is the nipple. The tumor mass, which is somewhere here, the tumor extends to the nipple area, and there is subsequent secretions which coat the nipple. And this subsequently leads to scaly covering over the nipple. Now this must be differentiated from eczema. Paget's disease is commonly unilateral, while eczema is bilateral. Paget's disease is very commonly associated with intense pruritus, may be associated with ulceration, And in around 50% of the cases, it is progressed into invasive type. That is, in 50% of the cases, a palpable mass can be felt. In this microscopic image of Paget's disease, we need to look at the characteristic Paget cells. These are called the Paget cells. They are large, so they have adequate amount of cytoplasm in them. They are characterized by presence of a lot of mucin, and they stain lighter than the rest of the cells. These are called as the Paget cells. DCIS is treated with surgery, that is mastectomy, and that is followed by radiotherapy and chemotherapy. And anti-estrogenic drugs such as tamoxifen are preferred. Next, we have the lobular carcinoma in situ. In this, we see loosely cohesive groups of tumor cells. Why is there less cohesion between the cells? This is because there is decreased expression of E-cadherins. Why is there decreased expression of E-cadherins? Because CDH1 gene mutation is seen. And this is not commonly associated with secretions or necrosis, and thus there is no calcification. And it cannot be picked on the mammogram, and so it is normally only an incidental finding. Presence of lobular carcinoma in situ in one breast increases the risk of invasive cancer in both the breasts, and thus a prophylactic bilateral mastectomy should be done. So until now we spoke about carcinoma in situ. Now let's look at the infiltrative carcinoma. Infiltrative carcinoma can be classified on a molecular basis and on the histological basis. According to molecular classification, we have 4 types: luminal A, B, HER2 new enriched, and basal. So this depends upon whether they are expressing estrogen receptors, progesterone receptors, and the HER2 new receptors. Luminal A and B both are positive, or they express ERPR, while they do not express HER2 new. While luminal B may express HER2 new, HER2 new enriched group do not express ERPR but has overexpression of HER2 new. The basal type does not have the expression of either of any of these receptors, and that is why it is called the triple negative. Among these, luminal A has the best prognosis and HER2 new enriched tumors have the worst prognosis. According to histological classification, we have the no special type and the special types. The no special type is a new name given to the invasive ductal carcinoma. This is the most common type of invasive cancer, and it presents as a breast lump. And this is mainly in the upper outer quadrant, and this pattern is common to any kind of breast cancer in female. It is more common in the upper outer quadrant. It's because the mammary tissue has the highest density in the upper outer quadrant. There may be skin retraction, nipple retraction, or nipple deviation seen. And because of the obstruction to the lymphatic flow, there could be cutaneous edema leading to the pudiorange appearance like this. It is similar to that of an orange. The first one among the special types of invasive carcinoma, we have the invasive lobular carcinoma. Here, like that in lobular carcinoma in situ, we have loosely cohesive groups of tumor cells. This again is because of CDH1 gene mutation, which leads to decreased expression of E-cadherin molecules. It normally presents as bilateral and multifocal cancer, and it presents as an occult primary cancer. Occult meaning hidden, that is, you cannot really find out that there is this carcinoma existing. Why is it occult? One, you cannot really feel any lump, because as already mentioned, it is loosely cohesive groups of cells. So the cells are not going to bind together to form a lump. Second, there is no calcification, so it cannot be picked on the mammogram either. Microscopically, we see that there is single line pattern of the tumor cells. So the tumor cells are arranged in a single file. The next type of cancer, special type of invasive cancer, is medullary carcinoma. It is associated with hypermethylation of BRCA1 gene promoter, because of which there is underactivity of BRCA1 gene. Microscopically, we see sheets of anaplastic cells and lymphoplasmacytic infiltration. Mucinous carcinoma, tubular, and papillary carcinoma are the other types of invasive carcinoma. Among all the invasive carcinoma, best prognosis is that of tubular carcinoma. Here we're done talking about breast cancer. I hope it really helped. If it did, like, share, and subscribe.